a few family members that they have changed their lifestyle, exercise, the right foods, and unfortunately, the cholesterol was still, in the high numbers, shall we say. And bottom line, it can also be genetic, correct, doctor? The predisposition?
Absolutely, right? So there's two reasons you can have high cholesterol. One is genetics and other comorbidities, and of course, diet. So, and there's some folks who have genetically predisposition to very, very high cholesterol, and they could be vegans and be perfect weight and run every day, but still have very, very high cholesterol. So that's why a lot of times lifestyle is not enough in itself, right? So there's that faction of people who get high cholesterol because of their lifestyle and diet choices, but then there's that faction of people who have stuck with bad genetics, and there's everybody in between. So that's, again, a very good and important point, and it's something we have to make sure people understand that sometimes lifestyle is not enough.
All right, doctor, I want to show our viewers a short video from the CDC about statins and how they work, and you and I will talk about it when we return. Take a look.
Millions of people in the U.S. take statin medication. The main way statins can reduce your risk of a heart attack or stroke is by lowering your cholesterol levels. Cholesterol is a fatty substance made by the liver. There are two major types of cholesterol: good, HDL, and bad, LDL. Bad cholesterol can leave fatty deposits in your arteries that build up, restricting blood flow and increasing your risk for a heart attack or stroke. If you are already at high risk for a heart attack or stroke, your healthcare provider may suggest adding a statin in addition to making healthy lifestyle changes. Statins help cut the amount of bad cholesterol your body makes. You'll have a blood test before starting your statin and afterwards to check if it's lowering your cholesterol. Statins can reduce the amount of fatty deposits in your arteries and stop any more from building up. Statins also make existing deposits less likely to break off and cause a blood clot. A blood clot can cause a heart attack or stroke. It's important to take your statin medication every day. You can remember to take your statin by making it a part of your daily routine, like brushing your teeth or eating a meal. Most people don't have side effects from statins, but as with any drug, some people do. Side effects are usually mild. Muscle pain is a possible though uncommon side effect. Don't stop taking your statin if you think you're having side effects. Your cholesterol level is likely to go up, and this could put you at risk for a heart attack or stroke. Speak to your doctor or healthcare team about your concerns. If needed, they can change your statin to a different one that may work better for you. A study of more than 135,000 people at risk for a heart attack or stroke found that those who took statins had a 25% lower risk of having a heart attack or stroke compared to those who did not take statins. Statins are among the safest and most studied medications. Statins save lives and prevent heart attacks and strokes. Learn more about lowering your cholesterol at millionhearts.hhs.gov.
All right, lots to unpack there, doctor, lots of information. I guess the first thing I want to know is how often do you prescribe statins? A lot?
Great question. So, correct. Statins are probably the most prescribed and most studied medicines out there, right? I, as a cardiologist, prescribe statins very frequently, right? And, I just quickly, I like to divide folks into secondary prevention and primary prevention, right? Secondary prevention means if someone's already had a heart attack or a stroke, meaning they have established disease, those are the ones that there's a no-brainer that statins, without question, are going to help save your life. Primary prevention, like the video talked about, folks who have never had an event and we're trying to prevent them from having a first event, that's where all this controversy, debate, and it gets a little bit murkier, trying to give somebody a medication for preventing something that hasn't occurred yet. But I see a lot of folks who've had disease, therefore I prescribe a lot.
So let's follow up on what you just said. Do you normally prescribe them to people who have made that effort with the lifestyle changes, with the diet, with the exercise? Do you then move forward and say, okay, we need to prescribe a statin here?
Right. So if it's somebody who's already had a heart attack or stroke, no matter what, you're getting a statin, and I'm going to add to that lifestyle changes. Now, for the folks who I'm seeing for preventative measures, for somebody who's never had a heart attack or stroke, It varies. So without question, I'm instituting lifestyle modification first. And I tend to do that before I jump to the statin in that population, because I want to see those numbers before and after diet and exercise. And it helps get patients a little bit of motivation to see that they're going in the right direction. So I find that doing that first and then figuring out if a statin is going to be the next step, depending on what their numbers are and their risk profile is, that strategy I think works the best.
And I have a question from a viewer who says, once on a statin is always on a statin?
Not for everybody. For some people,
Uh-huh.
again, like if you've had a heart attack already, yes, you're going to be on a statin for life. For other folks, let's say you're obese, you have some diabetes, you're an unhealthy person, and you're on a statin because your cholesterol is way out of whack, but you change you change your lifestyle, you exercise, your diet changes, you drop the weight, your diabetes improves. There are people that I've taken off statins in that primary preventative population.
Great stuff. Thank you, doctor. We've got some more questions to get to. I do want to remind our viewers again, if you have a question for our experts, very easy to send those questions in. Here it is, questions for the experts. Email it, questions@allhealthtv.com, or you can even give us a call, 855-796-4475. And as always, you can check out our website, allhealthtv.com. A question here from Maria, doctor, another interesting one. She's following a healthy lifestyle. Great stuff, Maria. And she takes calcium. She writes there that she's 74 years old. Is that why you can have calcium plaque in the arteries? Should I stop taking calcium? She's concerned, she adds here in the question that I have, that it could put her at risk for heart disease. Your thoughts, doctor?
Good question, and one we often get. So, when we talk about heart disease or plaque buildup in the arteries, or atherosclerosis, as we call it, these plaques, these cholesterol plaques that build up in the arteries also can have calcium deposits, right? So people who have a lot of heart disease have plaque and calcifications of those arteries, okay? That calcification occurs with inflammation and these biochemical processes that are occurring within that cholesterol plaque. This does not have to do with dietary calcium intake. Dietary calcium intake is used for supplementation for various issues such as bone health and whatnot, but taking oral calcium does not increase your risk. And that calcification that's occurring in your arteries with this plaque buildup is independent of dietary calcium. So that's not anything I would worry about from oral calcium related to heart disease. Yeah.
Thank you, doctor. We have a few minutes left, and I'm going to do a 180 here with your permission and talk a little bit about COVID-19 and the pandemic,
Please.
Since it's still around, unfortunately. And as they're saying, the end is almost near, or we're hoping, because of these vaccines. So my question to you is, there's still a little bit of fear, doubt in receiving these vaccines. I got mine. I got the Pfizer vaccine, and I felt a sense of relief once I got it. Your thoughts on the vaccine, and to help educate our viewers as to the importance behind it.
Absolutely. As expected, when these vaccines came out, there was a lot of hesitancy and there was a lot of concerns from folks. Now, what I'm hoping is there's so many people who have gotten the vaccine, depending on whichever type of vaccine, Pfizer, Moderna, et cetera. There's multiple out there, obviously, but millions and millions and millions of people have gotten the vaccine now, right? And we know with vaccines that if you're going to have a problem or a side effect with a vaccine, that's usually going to happen in the short term. So I'm hoping now that more and more folks who have been getting it, people, friends of people and relatives of people who have concerns are getting it, healthcare workers are getting it, and we're seeing a robust safety of these vaccines. I'm hoping that's going to continue to motivate and appease any concerns of folks who are still a little hesitant, not to mention the motivation to get back to real life. I'm the biggest proponent of masks and all this stuff, and I hate them. And I'm just hoping, combining with the safety data that's out there and, the sickness we are all, have come into from this lifestyle, that people will eventually realize this is the correct strategy to get us out of this. And yes, there's going to be some hiccups. Yes, there's going to be some small number of side effects. And, but I think you have to look at the big picture here. And I'm hoping people will continue to start to come around, the ones who have not.